Justin Cadillo from BSN18. So I'm here to perform proper wound dressing. So first, let us move in the assessment. So in the assessment, let us first check the orders of dressing change. So let us read the charts for information that reflects the development of possible implications such as elevated temperature, pulse rate, WBC, and or positive wound culture. So next is check the current dressing. So check the size of the wound, the presence of any discharges, and the amount of dressing materials needed. So checking the size of the wound and the materials needed are also essential part of this. So next, let us move on to the materials and equipment needed. So determining what materials and equipment needed for us to request it if not available in the bedside. So next is, let's move on to the planning. So first, we need to gather all the materials and equipment needed. Checking the materials and equipment needed promotes organization and time-efficient management. So always remember, before and after every nursing procedure, we should wash our hands for us to remove all the microorganisms that are present in our hands.
Then, identify and explain the procedure to the client. An explanation encourages the client's cooperation and reduces apprehension. Close the door or the curtain. Use a bath blanket as needed when exposing the area to be dressed. Closing the door or curtain provides privacy and warmth. Assist the client to a comfortable position that provides easy access to the wound area. Consideration for the comfort of the client is a primary concern. The nurse promotes good body mechanics to avoid muscle strain. Then, place an open cuff plastic bag near the working area. Soil dressing may be placed in the disposable bag to control the transmission of microorganisms. Then, loosen tape on the dressing. Use an adhesive remover if necessary. It is easier to loosen tape before putting on gloves. So when you are losing on the tape, please be careful, for the client can feel pain and can have discomfort. So please be careful and just take your time. Don a clean, disposable glove and remove soil dressing carefully. Check the position of the drain. Before removing the dressing, if a dressing is not wet to dry application and is adhering to skin surface, it may be moistened by pouring a small amount of sterile saline onto it. A glove protects the nurse when handling contaminated dressing. Using caution in removing a dressing promotes comfort and ensures that a drain will not be removed if one is present. Sterile saline loosens the dressing for easier removal. After you remove the soil dressing carefully, discard the dressing in the plastic. Then, pull off glove inside out and drop it in the bag. Then, wash your hands after you have successfully removed the gloves. Using aseptic technique, open the sterile dressings and supplies on the work area. Supplies should be within easy reach to maintain sterility. Open the sterile cleansing solution and pour it over. Pouring solutions over sterile dressing supports principle of aseptic technique. Then, after that, don sterile gloves. Using sterile gloves prevents contaminating sterile equipment and introducing microorganisms within the wound. Cleanse the wound or surgical incision using sterile forceps if desired. In my case, if the wound is large, use long downward motion from the wound edge moving out. Use each swab only once. Clean 2 to 3 times as indicated. Cleaning removes drainage, debris, and microorganisms. Aseptic principles direct that an area be cleaned from the least contaminated to the most contaminated area. Apply a layer of dry, sterile dressings over the wound. Use sterile forceps if desired. The primary dressing serves as a wick for drainage. Place sterile gauze under around the drain if one is present. The gauze absorbs drainage and protects the surrounding skin area. Apply the second gauze layer to the wound site. The second layer provides for increased absorption of drainage. Apply a third layer over a wound as the outermost layer. The last layer of the dressing protects the wound from microorganisms in the environment. Remove the gloves from inside out and discard them in the plastic waste bag. Apply tapes or secure ties to place the dressing in place. Tape is easier to apply after gloves have been removed. Then, remove all the equipment and make the client comfortable.
So always remember, before and after every nursing procedure, we should wash our hands. So that is the proper wound dressing.